pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Laws, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place. This meeting of the Westborough Board of Health will be conducted by remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public or to parties with a right or a requirement to attend this meeting can be found on the Town of Westborough's website at town.westborough.ma.us. For this meeting, members of the public wishing to watch the meeting may do so in the following manner via westboroughTV.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of Westborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. It looks like Syed and Alan are both here. Can you guys just test to make sure that we can hear you?
Syed, can you hear me?
Yes, we can, Syed.
And this is Alan. Can you hear me?
Yes, we can. Excellent. So we do have several things on our agenda tonight. The one with the time restriction on there is the first one will be at 5:45 to discuss the high school graduation plan with Ember Bach. She has already connected and verified all her connections are working, and she was going to rejoin at 5:45. So we just want to bear that in mind as we start. I think the first item on the agenda was to elect a new chairman.
I nominate Dr. Ehrlich.
Well, that didn't take long.
So I think there was some stuff that we were waiting to hear back to make sure that Dr.
I
Ehrlich
have in fact been reappointed and sworn in.
Excellent. So you are eligible for being nominated.
Yes.
So yeah, Alan, unless you really don't want to,
I obviously you and I have been alternating, and I think it's just a good sort of best practice to keep doing that, and that makes sense to me.
Okay. So I will second the nomination for Alan Ehrlich. We'll do it by roll call vote. Dr. Hashmi?
Yes.
Dr. Ehrlich?
I'll say yes.
Dr. Walsh, yes. Okay, so I guess we'll hand that off to you then, and you can run the meeting, or do you want me to run it for today?
Honestly, I'm surprised you put it first. Usually it's like the last item on the agenda. And I figured you were just going to run the meeting, and then I would take over for the next time, but I don't care either way.
You see, when you're chairman, you can do it at the end of the meeting. You know?
No, I'll do it at the end of June, like it should happen. In any event, okay.
Anyway, if you want me to run through today, I can. That's fine.
Yeah, go right ahead. Feel free.
Okay.
Before we hold on a second, before we move, the new chairman feels full of himself. Just want to acknowledge, Dr. Ehrlich's, chairmanship during a especially trying time. He helped.
Dr. Walsh's?
Sorry. It's been a long day, Alan. Dr. Walsh's chairmanship. Yeah, between the two of you, how can I keep myself straight? During an especially trying time, he helped worked with our various boards and our staff to do our town election and then our town meeting. So, just a thanks.
So I completely agree with you, Syed. I think both in terms of the special efforts to make sure town meeting went as smoothly as it did, and in addition, all of the excellent collaboration with the Board of Selectmen. So on behalf of the Board of Health, I would like the Minister to reflect that I move we commend Dr. Walsh for his service during these extraordinary times. Is there a second?
That. Yeah.
Okay.
I guess we have to vote on it. So Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Okay, and I'll abstain. I think I did a humbly, decent job in these trying times. I think that everyone is, working really hard, so I don't want to take any particular credit there. But,
and Paula, if you decide to print out a certificate of appreciation for him, that would be great too.
I'll get right on that.
Who am I to argue with the chair? We have the approval of the minutes for June 2nd and June 13th. Do we have any discussion on that before we?
It's June
Make
6th,
motions?
Nathan.
I'm sorry, it's June 2nd and what?
16th.
And June 16th.
Yeah, I actually do.
Okay.
Sayed.
Yep, go ahead, Syed.
Paula, this is really just a minor editorial point. Can you just add, if it's possible, for the June 16th minutes that, I arrived at 5:50, but is it possible to just add, if the board is okay with it? I had a Board of Selectmen meeting at the same time, so I arrived from that. That's why I was late. If that's okay with the rest of the board.
It's fine with me.
Yep, adding in something extra just to explain why is perfectly fine. Yep.
I'll take care of it.
Thank you, Paula.
So with that, I'll entertain a motion to approve the minutes for June 2nd and June 16th.
So moved.
Do we
I
have a
second.
Excellent. So Dr. Ehrlich,
Yes.
Dr. Hashmi,
Yes.
Dr. Walsh, yes. We might as well start on the director's report. We've got about 8 minutes now. Let's see.
It's Syed. Can I just ask just a quick follow-up question
On the minutes?
on the director's report? Are we
Oh, yeah,
discussing
please.
that?
Yeah, this is the right time. Go ahead.
Okay. Steve, I think you've already told us this, but just because you had it in your director's report, I just want to just make sure we're all on the same page. So correct me if I'm wrong. It's going to be Worcester that's going to be helping with the tobacco control, right? Right.
I believe we're part of Leominster now. Worcester
That's,
gave,
or is it? But it's like cooking, right? Am I right? So that and I guess with COVID everything has been on hold. Am I also correct?
Correct. So the quick history on this, Worcester was the lead agency for, I think, 15 to 19 communities as far as the tobacco control. They decided not to renew their grant probably about a year or more ago. In that time, the state has been looking for other communities to become the lead agency. And I believe Leominster has stepped up, and they are going to add us to their existing program, which already covers several towns out that way. So we're getting that together. It's still kind of, we're still kind of moving towards getting everything organized, but that's what we'll be doing in the foreseeable future.
And Steve, remind me, do we have to pay into this, or somebody does it for us?
No. This is a grant from, I think it's just from Mass Tobacco Control. It's
Okay. All right. But
no.
we'll be in a larger group again. So that's good.
Correct.
Okay.
Yeah,
Thank
we
you.
get to share all those costs, and I think that even if the grant were to run out, then we'd still be sharing whatever costs are attributed to it.
Steve, I don't know if you were going to discuss this under director's issues. It's mentioned in your report, so whether you want to talk about it now or during director's issues, I do think we should be updating the board on the waste management discussions and where they're going.
I was going to do that on the director's issues. I can do
fine.
it now.
No, that's fine for doing it later. Just want to make sure we did it either here or there.
Yeah, we have the waste management contract that we were going to discuss today anyway.
Okay.
So,
Yeah.
So, and Steve, since we're discussing this, are you going to be discussing our numbers in your issues? Am I getting that correct?
I can.
actually, if we want to take a couple minutes and just start discussing that now, I think that would be of particular concern.
Sure. So I believe right now we've had 7 new cases this week. A few of them are out of one of our long-term care facilities, all asymptomatic. There are certain testing requirements for long-term care facilities on a routine basis. So this isn't really unexpected, but that's where the numbers stand right now.
And as far as the cases that are outside the long-term care community, how has the contact tracing been going? Have we been finding that it's spreading mostly like within family units, or have we found that these are just, several different independent cases that have come to town, or are they somehow connected?
Yeah, hard to know. It's kind of, I haven't had any really anything I could rest my hat on as far as it being related or anything like that. A lot of them are asymptomatic. So there was one, I don't want to get into it too much. For instance, there was a gentleman who got admitted to the hospital for emergency appendectomy. So he was asymptomatic, but they test everyone going in there. So they caught it, so we're getting stuff like that where people don't have symptoms, but because of whatever's going on in their life, they're getting tested, and we're getting those cases. Not a whole lot of symptomatic cases that I'm getting right now. It's more associated with other, things as far as
other reasons why someone would get tested. Yeah.
Correct.
Okay.
Right, and so I was going to, and I don't want to put Dr. Ehrlich on the spot, but do we want to just add that do we want to add a disclaimer or to the point that Steve was making, that these cases, the new cases that we picked up were picked up, through, because they were not symptomatic. Sorry, they were picked up by other means. Do we want to make a statement about that? So to kind of,
I think something, putting in a statement that, we're seeing an uptick of cases that reflect testing that's being done in people who are not necessarily symptomatic, is fine. I think, that does put things in perspective. I'd be cautious about making broad statements, or saying like all are, asymptomatic.
No, I'm just saying maybe we can, maybe if you don't mind, not to, I like to throw you under the bus, but I was just going to say maybe, but maybe towards the end of the week, you can touch base with Steve and see where things are, and maybe just release.
I'm happy to collaborate with Steve, and we'll
just release a statement, just release like a update or whatever, just so that I think it would help the town, because they're focused on the number, and what we want to do is provide them the context that, hey.
Yep.
Thank you.
Well, again, overall, I'm sure you've been following the numbers, and statewide numbers are really down quite a bit.
Knock on wood, man. Knock on wood.
Yeah.
We've had a resurgence of people that have other boards of health have complained that they're having trouble enforcing isolation and quarantines, and that it's really all voluntary mostly at this point, where like we tell people that they're supposed to quarantine, and we ask that they do it, and they actually follow what we tell them because it sound scientific guidance. But there's been a resurgence in Massachusetts of boards of health complaining that the people that they're giving these, guidance to are not following it. And so I don't think we have a problem yet here in Westborough with people following this. But if it turns out that we need to do anything further, the state has basically said that if the Board of Health needs to issue orders through a court to have someone confined for isolation and quarantine, that the state is supporting the local boards of health. So I don't think we'll ever need to use that authority, because I think people here in Westborough actually will, respect why we put quarantines and isolation into place. But I do just kind of want to remind the board that the state has come down and said that they would support us if we needed to. Do we have anything else on the director's issues or director's report? Being nothing, I'd like to entertain a motion from somebody.
I move we accept the director's report as presented.
Do you have a second?
A second.
Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh, yes. So with that, we're right about 5:45. We have, it looks like, Amber Bach and Brian Callahan here with us, and we wanted to have a discussion about the high school graduation plan.
Sure. So I forwarded you an email from Brian regarding, kind of an overview of what their plan was for the graduation, ceremony in a few weeks. And I just felt it was probably a good idea to come before the board just to make sure that everybody's comfortable with what they're proposing, and then have Brian and Amber here just to kind of fill in any blanks or answer any questions that you might have. So here we are.
Oh, go ahead, Brian.
Okay. Well, I might as well, start out, and then maybe as you look over that email and hear my presentation, you might have some questions. But, first of all, I just want to thank you all for the opportunity to, answer any questions that you might have. But also, back in May and June when we ran our two big events, the stroll down memory lane and then the parade. I think, you took a big chance on us at the, not quite the height of the pandemic, but we didn't know we were out of the woods yet at that time. And we definitely appreciated your support and approval of those two big events. And we ran them, I think, very effectively, very efficiently, and followed the guidelines. And I just want you to know, if when we move forward with this graduation ceremony, we're going to do exactly the same thing. Very organized, very orderly, and run it very effectively. So having said that, very briefly, and then we can open it up for questions. We're going to be following very strictly the DESE and the Department of Public Health guidelines that were issued jointly. I believe back in late May, early June, when it appeared that sometime in July and beyond, outdoor graduation ceremonies could take place. I believe you've seen those, and the highlights of them are obviously 6 feet of distance, between families that are in audience, 6 feet of distance or more for students that are sitting on the turf field, similar to town meeting. We'll have everyone separated and socially distanced. We'll have every attendee pre-register, and we will be checking, our those that are coming against our pre-registration, and those that do not pre-register will not be allowed in. And we have a very different looking processional and recessional than what we're used to. For those of you who may have seen or been part of a graduation, the procession is typically two students standing side by side, and they march pretty methodically in, to pomp and circumstance, and then they file into their rows, and then they're seated accordingly. And then the recessional is kind of a free-for-all, where they march to the end of the turf field and throw their caps in the air. We will not be doing those traditional processional and recessionals. Everything will be single file with social distance, and students will actually have assigned seats that they will go to. And they will actually enter their seats on the turf field from 4 different locations. So if you can envision the turf field and your back is to the press box and you're watching a game or a ceremony on the turf field, there will be 4 sections of student seating in the shape of a U. There'll be one section, if you're looking at the stage and the podium, one section to the left of the podium, one section to the middle center of the podium, one section to the middle right of the podium, and one section to the to the right side of the podium, kind of in the shape of a U. And we'll have between 40 to 55 students separated with 6 feet or more in each of those sections. And those 4 groups will enter from 4 different parts of the field. So if you think of the track now around the field, where the turns are, those are, kind of 4 corners, they're rounded corners. The students will enter from and exit to those 4 corners. Again, single file, keeping it distance. And we have a very similar plan for families and attendees that have pre-registered. When they arrive, we will single file them to a seating location, either in the bleachers, on the banks of, on the sides of the bleachers, the hill, and also standing room. So, and we will have handicap seating available for those that have identified the need to have handicap seating. There's been 6 communications sent out total, specifically around the guidelines, 3 to students and 3 to parents and guardians. So we have approximately 3 to 4 more scheduled between now and August 1st. Again, reinforcing the social distance, the pre-registration, and wearing of masks at all times.
Good.
So those are the highlights.
I think that having it outside gives a huge element of safety compared to having a graduation indoors. I think that the Westborough High School students in general are excellent people that are very responsible, that can follow directions on a field, for something like graduation. So I expect that that's going to go real well. Some of my biggest concerns are, how do we make sure that the people that are arriving, because all the parents that, arrive at the same time, when they go to form a line to, get into their seats and their seating, from the email, at least, I didn't get a real sense as to how that's being coordinated. And I don't know, maybe you guys already have a much more detailed plan that just wasn't shared in this 2-page email, or maybe you don't have it. And so I'm kind of feeling you out to figure out whether you already have that documented somewhere, or whether we still need to develop that document.
So at the time of the email, we hadn't formalized a plan. We had some idea of what we wanted to do. But since then, we certainly have developed our plan a little bit more. And frankly, we do have a few more logistics to work out relative to properly and orderly seating our spectators. The students, I think, will be very easy as we assemble them into those 4 areas and space them out. We'll be able to enter and exit them very easily. With the parents, we'll have 12 to 15 ushers, as they enter and report that they're here, and we check off that they pre-registered and they're part of the immediate family household. We will have one usher take them to a location, the bleacher. Let's say the bleachers are the first thing people want to sit in. And we will have a 6-foot sort of a pole, if you will, like a wooden dowel. And as soon as the last member of that family sits down, let's say it's a family of 3, we will measure 6 feet, and behind that usher, who has identified 6 feet from that last person in that family, there will be another usher bringing in another family, could be of 2, could be of 4, and sit them kind of in that row 6 feet from that one family. So and then the row in front and the row behind will be left empty. So we'll kind of funnel people in and sit them accordingly. People will have to wait and be patient as they wait. And, we certainly have to practice and rehearse a little bit of this, but our thought is that with 12 to 15 people, 5 Westborough Police Department detailed officers, will be able to kind of manage the flow in and the seating of our spectators. It'll take a lot of work, and time, but we think we can do it safely and pretty efficiently.
I'm sorry. Do you have other questions, Dr. Walsh, or can I
No,
ask?
actually, if you want to go ahead and jump in,
Yeah.
that's fine.
So I don't have any concerns about your ability to get people in an orderly fashion. My concern is that given the 6-foot spacing, how do you possibly expect to fit everybody in the space that you've described? Especially when you're leaving every other row empty in the bleachers. Even with the side hills for people to sit on, it seems incomprehensible to me they're all going to fit there. And, for what it's worth, if it were up to me, I would use the adjacent ball field and set up a jumbotron of some sort for people to watch. Because that's the only way you're going to get all the people down there. But you tell me if I'm wrong or you had other ideas.
Well, we think the majority of people will have to be around the track, along the fencing area of the track, all the way around, even standing behind the stage and kind of facing. So
you're using the track to space people out?
Yes, we are. Yep. We are.
I didn't hear that in the initial proposal. I'm sorry.
No, I didn't. I wasn't that specific. Yeah.
Yeah, no, we'll be spacing them all the way around. I think some people will opt to stand over on the sidewalk area down the side. And I think Brian's anticipating that people will space near the area where their student is marching in. So by organizing the students into 4 different groups, I think families are naturally going to gravitate towards the areas where they can get as close as possible to where, their child is going to be. So, and I think because they have to pre-register, we have a count. So we usually just run it as family units, and we should have some sense about mapping it out, similarly to how we did the memory walk.
Yeah, so I guess seeing a picture of kind of where you expect to put people, even if it's a rough guess, just to kind of help make sure that the numbers that you're thinking actually will work. I think that would be useful for us to see. I'd rather kind of front run a problem like that than to have it, be a couple of days before and then have it realized that, that sort of spacing isn't going to work. We did something like that for the town meeting, where we kind of, put in where we thought we were going to be able to put people, and it wasn't exactly as drafted, but it was pretty close, and I think it worked. And so at least having some sort of draft picture as to put little X's down, or how you're going to spread them out. Have you guys thought, when people are going out onto the field and spreading out, are you marking the field at all, or just kind of having people reach out to make sure they can't touch their neighbor type of thing?
So we haven't made the decision to use another field. I think that's a great, that's definitely a great suggestion.
I thought the students were going to be on the field. Right?
No,
The
yeah,
turf field. I thought you meant the spectators. I'm sorry.
the chairs
no,
are all.
Yeah, the students will be in chairs. Yes, we do have that marked already. Yep,
Yeah,
we
they're
do have
already
that.
marked out.
Okay, so this raises another set of questions for me.
So what we have traditionally used. I think I'm on a little bit of a delay. Sorry about that.
There was, finish your thought, and then I will ask my question.
Yeah, we traditionally have spaced the chairs on kind of platforms, so that the legs of the chairs wouldn't, tuck into the turf or perforate the turf in any way. So we've always had, protection, I guess. And when we laid those out last week, we found that we could fit one chair on one of those stanchions and maintain our 6 feet between chairs. And then 70 chairs wouldn't fit on stanchions because we don't have enough of those platforms. So we've got furniture caps, and we put those out, and we kind of have a decent layout. But we can definitely make a diagram that's a little bit more specific and get that to you at the end of the week.
That sounds good. The next thing, though, is if you're planning on a non-trivial number of people being stationed around the track, then you have to make sure that at the end you have an orderly return to cars, and that would mean the graduates staying put while the track gets cleared, or else you're going to have the typical pell-mell that occurs at the end of these types of events. So that, I think, figuring out how the end of the event works is as important as anything else.
Great point. And we've had a couple of ideas on how to do that, and we certainly have not settled on one versus the other, especially if we find ourselves, as you just said, where there's more people standing on the track than we anticipate. So,
I remember fondly my daughter's graduation, and how nice it was to kind of run onto the track and give everybody hugs, and even those people that weren't your kids, to congratulate them. And so it's a shame that we're going to miss some parts of that. And I don't know how to recreate that safely. I think that you can't. You just have to kind of wave and smile, and But So we do have the plan to have plenty of public service announcements. That even during the ceremony, or at the beginning of the ceremony, or near the end, kind of cueing people as to what to do and when to do it. So we were working on some of those PSAs, not just to email out to families, but also in the moment, in graduation, reminding people what they can and cannot do. So it will, it's going to be different. But I think with the number of people that we have, and we're going to have our first test run of seating people this Friday. And then we're going to continue to work on that early next week. So if you meet again next Tuesday, I can certainly have more information to you by then. Yeah, I think if you get something to us before then, we don't typically meet every Tuesday.
Okay.
So I think that if you can get us something that we can look at, if we think that it's looking appropriate and that nothing needs to be done, then we might be able to just kind of individually say, no problems seen.
Gotcha.
And if somebody sees a problem, then we might have to, get together so that we can, discuss the issue.
For sure.
Unless, Alan, you see some other, or Syed, you hear some other way of, getting this kind of feedback to them in a reasonable time frame.
No, I agree with you. And I think, obviously Steve's the point person. So you communicate with Steve, and each of us will individually give any response to written materials to Steve, and judgment will be made whether there are issues that require a meeting or not.
That'd be
Yeah.
great. Thank you. I do think we're used to graduation being also, very full. And because we're just inviting family members, I think, you're streamlining the true number of people that are there. I mean, graduation is attended by so many people other than families. So pulling it down to just family units, I think will thin that crowd and give us an opportunity to get a picture for how many numbers we'll have. When's the deadline, Brian? You've got the deadline set for their form.
Next Monday.
So we should start to get a hard count, and then we'll chase the ones that we have questions on, and then we can, boil it down to the logistics of real numbers.
Right.
To Ellen, to your point about egress and leaving, I do think that because the parents aren't going to leave without the student, I think that slowing the students leaving their seats and going out to join their parents to then leave in cars is probably going to be the easiest way to make sure that it stays orderly. I think that as soon as you let a large group of students go all at the same time, then you're going to have necessarily large groups of parents that are all, running to that entrance point to, of the fence to get out to their car. So I would encourage you to kind of think about some way of slowing the way that people leave, and that'll make it really easy to have it be orderly.
We'll probably take them out in those same pods they come in, because we broke them into 4 processionals. So, we'll probably exit them in those 4 processionals, section 1, heading out, finding their family and heading towards their car, and that takes a little time. And then we rotate the other section from the furthest distance on the field, which will take the kids the time to get across. Like, this is stuff we're good at, that we can figure out logistics. We move masses of people a lot. So, I think we'll dig in on it and make sure that Brian sends you the follow-up notes on egress and a clean map for just a visual where kids are, and then a rough number count on attendee parents and kind of where they'll be. So you get a picture of the kind of those key questions.
That sounds good. I think even if, if you want to tie the final numbers that you might get on Monday with the map, it might make sense. I'd hate to have you make the map and squeeze in, unreasonable numbers of people or not enough, and have to amend the map to, make it fit with the numbers. So you may want to just wait till you get the numbers to get the map.
Thank you.
Good point.
All right.
Do we have any other questions? Syed, do you have anything? It's hard to see whether you have any questions.
No, I don't. Thank you for asking.
Yeah, so I'd say that what I've heard, I don't have any issues with. I think it's on track. I think that, I just haven't seen a lot of the details yet. And so as we get these details, I think that, you're putting the right amount of thought into this. And so I expect that everything will go smoothly. So I don't anticipate any problems.
Thank you very much.
Thank you.
We'll exit and let you continue your meeting. I'm going to be contacting Steve to set up a set of returns so we can interact on the proposals for return to school. We're close to mapping out where we are. So you've been running a whole list of things you need to manage. Steve's continued to give us good guidance. We're working with the state right now heavily. We're in at 110%, really trying to figure out how to do all the logistics for a proposal. And tomorrow night I talk to my school committee, and then I'll start booking time with you and Steve to start talking about things.
Thank you. I think that this is obviously a big issue that, is how to reopen schools, and it does work with both the Board of Health and the school department to try to make sure that this goes successfully. The state's been very good about giving guidance. I do just want to make sure that, we do include the Board of Health in these plans, and hopefully you can leverage some of our skill sets to make sure that the plans that you have, work well. It's a huge risk in having all of our kids come back to school. And I am personally a little concerned about some of the state guidance that's out there, because it differs from the guidance that they're giving like regular businesses. And so it's going to be interesting to see whether they change any of their guidance or stick with it. But for instance, like when restaurants are opening and they say that, you can only have one family unit at a table and the tables all have to be 6 feet apart. That's not what they're saying for the schools, where they say that, kids can be at the same table. They're just supposed to be spread out.
So I certainly know it will be challenging. I don't want to bog down your meeting. We're not on the agenda for it, but I just wanted to acknowledge while I was here with you that certainly those are all being weighed heavily by over 150 teachers and by our leadership team extensively. And we'll make a preliminary set of early notes, a proposal to school committee tomorrow, and that triggers the start of ongoing open public meetings where the notes about what we're thinking are very, very much kind of meshing where we think we are as Westborough with what those guidelines are. And then, of course, that involves you guys. We've been collaborative all the way through this. And so I haven't tapped you yet to say we'd be coming back because I assumed you knew we would be. And we know that we'll be working with you. And I'll start by emailing Steve the report tomorrow after I present it at school committee. You're certainly welcome to watch, but you have too many meetings. You can just read the report and know that we'll have a lot of time to work together. Okay?
Yep. And one more thing before you guys go, and that's the Triple E. We're discussing it tonight, but it was predicted last year that this year was going to be another bad year for Triple E. And I know that MIAA is, looking at when sports can start and when they'll happen. And it seems like what they're doing is delaying, maybe is what I heard, some of the start of the season. And so that's going to push it more into the Triple E risk time frame. And so we're thinking about that. I'm sure you guys are thinking about that, but we don't want any surprises like we had last year where things happened and it was a surprise to people. So I also want us to make sure that we're continuing to communicate about that.
Well, I think we can put it on our list, and I think Steve and I, plan to use the space. This is hilarious now, Steve, like the space of summer to nail down our protocols for AAA. So, that got blown out of the water. So, we had anticipated the time to kind of review those protocols in front of the season. I certainly think that still has to happen, but we have a rough guideline. We know the responsive cycle that we ironed out, and I think we'll get that ironed out as well. So thank you.
Well, thank you, Brian. Thank you, Amber, for coming. We appreciate you, talking about this with us and letting us give some, ability to comment on it.
No, thank you for your support and the guidance. So take care, and we'll get out of your way and let you finish your meeting. All right. Take care.
Bye.
Thank you. So it's now 6:08. We're a little behind schedule. We're going to talk about the 2020 Massachusetts Arbovirus Surveillance and Response Plan. A short little 40-page.
Well, well, you kind of had a good segue into this already, Nathan. So the reason I put that in there, and it's great reading the whole thing, but mainly I wanted to talk about Appendix 2, which is in the back, which talks about if we had to, close the fields and municipal properties at night like last year because of Triple E activity. Last year there's suggested times in the back of the plan as far as when sunset is. And I just didn't, not that we have to vote on this or anything, but I think I just thought that'd be good to have a discussion on whether that's what we were going to follow this year with the suggested times, or if we were going to go on our own. It kind of makes it a little easier for the schools to plan if they kind of know ahead of time where things are going to be at. Last year we did not follow this specifically. We weren't too far off, but I know we were off, maybe half an hour, 45 minutes on some of the times, and that might have caused problems. So anyways, that's why I didn't put it on the agenda to discuss the whole thing, because that can take hours, but it was mainly to discuss that the Appendix 2, which is the closing times for fields if we do have to do so.
Yep. So what I have in front of me is on October 7th at 6:15, October 14th at 6, October 21st at 6, and October 28th at 5:45.
Do you have July, August, and September too? They're on the page before.
Yeah, I probably do.
Yeah. So Steve,
Yeah.
Can I just say that thank you. This is a great document. I don't know if we can put this on our website or whatever, but this is just, thank you for sharing this. This was just great. And if you want a motion from us, because I think these times are also good, right?
Well, yeah. I mean,
Do you want a
these are
motion on this, or
Well-
what are you looking for?
So I think that the board would probably like to make a motion on this. I think that for us, it was a little bit confusing where we were in responsive mode last year rather than kind of having something already planned out. And I think if we have, I think last year we decided that we were going to follow it, but I think it's good for this year to, now that we have this in front of us, to vote to approve this for the times.
I also like I also like the disclaimers on the side that, you know, this does not eliminate the risk, and I think that is I don't know if I think we made that. I don't know how I think that also needs to be part of the messaging whenever. Sorry, go ahead, Steve.
I'm pretty sure a lot of that was encompassed last year. I mean, I'd have to go back and look through. It was just a whirlwind when it happened, right? But like,
Right.
You know, this document is not new. I mean, it's pretty much the same. They've added quite a little bit, but it's pretty much the same document as last year. I don't know if the times have changed since last year, but you know, obviously, if we get to that point, I'll be referencing it a lot. So obviously, if we need to be posting closing dates, we will certainly put that wording in there, so add along with a lot of other information.
Okay.
So I'm fine with this document and these closing times. I do want to just say, because I have a different recollection of things, that I didn't think things were bad last year. The difference is we were not in alignment with other towns because we were closer to what this document has. The biggest difference between what this document has and what we did was I don't believe we made the 15-minute increments. So for instance, we would collapse, if you look at August, once 8 o'clock was no longer any good, we would go down, put all of the things at 7:45 down at 7:30. So you had fewer time changes and they changed in half-hour increments. At least that's my recollection. But
Yeah.
if this is just as easy for people, this is fair and it gives people the maximum opportunity to take advantage of the athletic facilities, which is good.
Yeah, so I think that one of the concerns I had last year was that, especially like the rec department, that was running like soccer practices with volunteers, it was tough to always let them know what the week-to-week rate was because we didn't have it in this form here that we had already, you know, agreed to. So I think if we agree on these times, this would let Steve kind of send this out to, you know, the school department and the rec department and say, if we're happen to be in a triple E advisory or whatever they call it, a situation where we're at high risk of triple E, that then these times go into effect for all the public fields.
So go ahead, Sid.
Oh, well, I mean, yeah, Paula brought up a good point. I didn't expect you to vote on it tonight. I figured if we get close to Tripoli, we'd probably have to meet anyways and talk. We could vote on it then, but I didn't put it on the agenda as a voting thing. I just figured it was an informational talk. But, you know, so I don't know if you can really vote on it tonight because it was not on the agenda. I just wanted to
Well,
discuss.
actually, I think the whole plan was on the agenda, and this is just one part of the plan. So I think we could tackle it if we wanted to. I mean, if we get feedback from residents that are upset that we went with this plan, we can certainly add it to a different night's agenda, and we can, you know, listen to other people's comments.
I guess I would break it into two parts. One is that we can endorse this schedule, but it really only takes effect once we have said we view the triple E threat in Westborough to be high.
Correct.
And I think that should take place ideally at a board meeting. I mean, obviously, if it happens on a Wednesday that there's mosquitoes found in pools in Grafton, you know, that are infected with triple E, are we going to, you know, is there danger in waiting for us to have our next meeting and things like that? That's the problem. Although my own bias is we will have more warning than, you know, that there'll be time to either have an interim meeting, you know, for 5 minutes that we can just call and just have that, or, you know, we'll have scheduled time. So
right. I mean, the other thing is we've actually gotten very used to these remote meetings. I think that if it turns out that in, you know, September that we have mosquitoes in Grafton that are come up on Wednesday and we want to do an emergency public health meeting, I think that's well within the guidance of the state for us to have a remote meeting. The three of us can, you know, hop on and, you know, decide whether we want to implement it right away if that was, you know, what we were thinking we wanted to do.
But going back to what Dr. Ehrlich said, and I think this may be helpful for Steve. So I think Granted, it's not a discussion and vote, so maybe what we can just do is, as a discussion item, say that the board endorses this document, so that Steve can then share this document with the schools and other like interested parties. I mean, just so that he has something to say, hey, look, I've shared this with my board. They're on board. Just so you know, this is what may happen. I think it's fair to them.
Yep.
Am I making sense?
Yeah. So if we want to make a motion to endorse this surveillance response plan, then I think that
I'll make that motion.
Steve the guidance he needs.
I'll make that motion.
I second it.
Dr. Ehrlich,
Yes.
Dr. Hashmi,
Yes.
Dr. Walsh, yes.
So just one other thing, just in case any of the residents are listening to this discussion. This is a great document, but one of the things that the document highlights about the spread of mosquitoes is that this is, that climate change has only accelerated this process. And that is something that we all need to be cognizant of and be aware of.
Yep. Let's see. We are done with Tripoli then. I think next thing on the agenda was the discussion vote to designate Director Bakari as the Westborough representative and Sanitarian Guthrie as the alternate to the Region 2 Public Health Emergency Preparedness Coalition.
Yeah, so this is just something we have to do every year. The Worcester, who is the lead agency in the coalition, just requires a letter every year saying that, I'm your approved representative for whatever we need to vote on, and that Ray would be the alternate. So we do this every year, if you remember, but.
Yeah, I vote for that. I make that motion.
I'll second it.
Dr. Ehrlich,
Yes.
Dr. Hashmi,
Yes.
Dr. Walsh, yes. No, I think it's a great thing to, keep doing. You guys have been doing a great job at Region 2. So let's see. 6:15, this is where we're supposed to have the discussion vote to approve the fiscal year 2021 solid waste contract with yale Harvey.
Sure. So you all got a copy of it. Basically, it's pretty much the same contract we've used for many, many years. The one thing that has changed is obviously the per ton cost did go up to $42 a ton. If you remember, we pay a tipping fee per ton that's disposed of down there. And that covers the cost of not only running the transfer station, but also hauling the trash to Wheelabrator. So I believe the last period it was 40, and then they went up $2 a ton.
In the leaf small brush pile didn't change.
No, that has not changed. That we get charged one fee for that. I think it's $96,000. That has not changed. I got to say 15 years, maybe more. They've never gone up on that. It's just been one cost. And we get charged that cost whether one branch goes down there or, 300 tons go down there. So it's just the one. Yep.
People do use it and people do like it. So I think that keeping that in there is good. I think that, a raise of $2 on 40, is that 5%?
Yes.
Just to give you a little history, they did not go up the 2 years before that. So it was $40 for fiscal year 2020 and fiscal year 2019. It was steady. So they held the price constant for the 2 years before this.
Okay. So that is pretty reasonable then. So actually I was talking with Ray earlier. When we go to sign these things, we have to both approve it as a board, and then we also have to actually sign it. And so we have to just figure out how to get some of these documents. Some of them require at least 2 people, but some require 3, I think, for these past 2 items that we're doing.
I think it's 2 for everything. So I'm happy to, I thought Erin, I think I was going to give Erin both these documents tonight. We haven't printed out. She can bring them home to Dr. Ehrlich, bring them back, and then I'll reach out to you, Dr. Walsh or Dr. Hashmi, and we'll figure out a way for me to get them over there for you to sign them.
Hold on, Steve. Sorry, it's Sayed. Can I ask you a question?
Yep.
Are the documents currently in the board of these documents that need to be signed? Are they currently in the Board of Health?
Are they in the board? You mean the blank
Are
ones?
they physically in our board office currently?
Yes, yes,
They are. Could I please ask? You know where Paula's office is? Sorry, Paula's desk.
yes.
Is it possible to leave them? You're not in the office right now, right? Am I right?
Erin is in the office right now.
Erin is in the office. Erin, is it possible for you to leave those documents in Paula's like on Paula's desk by any chance? I can try to come by tonight and sign them.
Sure, I can do that, and then I can drive them over to Dr. Ehrlich once they're signed by you.
I mean, you can just
Okay.
bring. Are you in the office tomorrow, Aaron?
I am not scheduled to be, but I'm happy to pop by because I'm driving around town anyway.
Right, because otherwise, or on Thursday, you could just bring him back that day. It's not like, I mean, if we get him in the next couple of days,
Yeah, there's no
that's all fine.
rush
Right?
on that. It's just
Yeah,
logistics.
and Steve, correct me if I'm wrong. There's another. Do we have to sign? Do I have to also sign your thing? Your declaration
Appointment.
also.
Yes.
No,
Yes, both
yes.
of those together. Yep.
Right. So,
So-
Aaron, if you wouldn't mind putting those at Paula's desk, I will come by and sign them.
Okay. Good.
Cool. And then I don't actually have to sign the Harvey's, contract, $1 billion, whatever it is. So, yeah, I think that that sounds good. I would entertain a motion then to approve the E.L. Harvey's 2020 contract.
So moved.
Do we have a
I'll
second?
second. I'll second.
Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh, yes. So unanimous approval of that, and that will be signed by Dr. Hashmi and Dr. Ehrlich. So going back now to, let's see, we voted to approve the director's report, I believe, correct?
Correct.
Okay. Moving on to the sanitarians report. The pools in
Yeah,
town.
I had a couple of questions. Sorry.
Go ahead. Yeah, you can start if you want.
No, I think Alan, Dr.
I
Ehrlich, did you have
was going to please correct the typo in the first paragraph. The following pools are indoor facilities.
There's actually 6 typos through the thing. I went through and started crossing them off, and if Nathan has any more, he can tell me. But there was 6. I was rushing through before vacation, trying to get it done.
Fine. So we'll assume that you and Paula will fix them.
document or a document that was a little bit rushed, and we opted for a little rushed, so we actually have something in front of us. So.
No, this is a great. I mean, thank you for all your hard work, Ray.
But I do think that when we approve this, we'll approve it with a little asterisk saying that you're going to clean up the typos. So.
Not a problem.
Good.
So, Ray, thank you again for. First, I hope you enjoyed your vacation. And then second, I was just some clarification. You know, you had this business about Arrive and temperature control. So I thought that the individual units should have their own temperature control. Am I not correct in that?
They do have their own individual control. The problem is the heating system is one major system and the air conditioner, and they can't be both set up at the same time. So if you had 30, this is what happened. They had multiple complaints that people couldn't turn on their AC system because the heating system was still on. So even if they turned off their heat, they weren't getting any cold air blown in. So they have to go on the roof of each individual building, shut down the heating system, and then turn on the AC units. So when they did that, this one woman complained that it was too cold in her apartment and she wanted heat. I asked her what the temperatures were. She told me it was 68 and 66, which are within the correct temperature requirements even for the winter inside the home. So I tried to explain to her, and she got upset that, well, I want it warmer than that. And I said, well, actually, they're meeting code, so I really can't get on them. But I did tell them they should wait until June 15th, and that's the proper time to shut down the heating system.
Okay. And then the other question I had was about Durrani, and I fully understand this is kind of not our issue, but they have been on, let's just say, on our radar for a while.
So just to let you know, last week, I think the Conservation Commission met on Tuesday. I got a text on Wednesday from Sherry, who told me they have contacted DEP, and they're going to have DEP come out. So if DEP comes out, they're going to catch the owner of the property, and the property manager is going to catch a rash of junk from them. and I think they're going to push it down to the restaurant, and we may see some changes down there. I don't know. But yeah, I did speak with them, and Sherry and I spoke with the manager and kind of laid the law down to him. She's been out a couple times. The area is cleaner than it was. They did do some cleanup, but the board wanted to call DEP in because they thought it was bad enough for that.
Okay, so just a question: has this been discussed by the principal with them, or just with you and Sherry have discussed it?
Me and Sherry, because like you said, it's not really a food issue.
Okay.
It's not a permit issue, so I didn't bring it into Steve. We're going to let conservation handle it, and DEP.
Okay.
DEP is going to be stricter than anybody else anyway, so I'll be invited to that meeting and just to see what's going on.
Can you just please keep us posted if that's possible?
Yep. Yeah, I sure will.
And then the last thing, and I don't know if this is appropriate or not, just tell me if it isn't. I heard JP is on the market. Is that correct?
Yeah, he did post it. It's publicly posted. He's had 4 or 5 people who are looking to purchase. We have a lot of places that are changing hands. We have a lot of places that closed over the last month and a half. So we're going to see a lot of changes over the next 2 to 3 months.
Okay, thank you.
I had a couple of questions. I think that you might have answered this last time pools came up, but all the pools that are not opening, they're still keeping them chlorinated and free of mosquitoes, and you're checking on those, or they just...
I have 2 or 3 of them didn't uncover. So Carlton Gardens, let me see, wait a minute. Park Village uncovered. Marriott Residence Inn did not uncover. Westborough Village is uncovered, and I told them all that were uncovered, they still needed to have a fence inspection, which they did, and they have to keep their chemicals at proper running levels.
Okay. And the ones that are covered, are
Yep.
they covered well enough that we think they're not going to be breeding grounds for mosquitoes?
Yeah, it's the same thing they do in the winter. The covers that they use, rain can go through, but you're not going to see it's very narrow, the gaps in there. You're going to get moisture can go through. Sometimes water stays on top, but we haven't had any heavy rains, and I've been checking on them. And I don't know if the Residence Inn was looking to get rid of their pool, so they were thinking about like maybe draining it, and that's a 3.5 foot, 4 foot pool. And when they drain it, they're going to tear it out and do something else in that area. But they haven't gone to the building department yet on that one.
Okay. Well, I think the other thing they could do is there's through mosquito control, right? They can put like a larvicide into the pool if they think they're not going to uncover it, just to keep it from breeding mosquitoes.
Yep.
Correct. We'll do that for pretty much any property in town. So if we get a complaint about a regular or even a residential pool, Central Mass will go out there and put a larvicide in there so you don't get breeding.
Yeah. Well, I would encourage these pools that are not opening to take that step.
Yeah, I did give Afaf is the general manager at the Residence Inn, and I did give her contact at the mosquito control to make sure that she would handle that one.
And then let's see, I had a question about Connector Road, the ESA. There was a woman that was saying that she was afraid the hotel was trying to evict her.
Yeah, that's an ongoing case. Steve and I, they fixed all the, we went in and finally, it was in July, so it's not in this report, but we did finally go in and do an inspection. We gave them a list. She did not allow them in for almost all of last week. She did let them in towards the end of the week. They called Steve and let him know that everything was done. Steve contacted her last Thursday. I tried contacting her yesterday and today. She hasn't gotten back to us. We think there's going to be one where she's just not going to call us back so we can do a re-inspection. But I'm going to call her every day till the end of the week, and then we're going to go down and knock on the door. If she doesn't let us in, we'll give her a 3-day notice, which is something we say you have 72 hours to contact us. If you don't contact us, we're going to figure that everything has been done correctly, and we're going to leave it at that.
Okay. My impression, and I'm not quite sure that I'm accurate, is that right now with COVID-19, they're not allowed to evict people. Is that correct, or am I misunderstanding the current rules?
Steve, you want to answer that
one?
I'm
not sure where that is at, Nathan. We wouldn't get involved in that anyways. We just want the room to meet housing code. So that's kind of between them and her. So I'm not sure where things, it's different. I really don't know where things are at with that, whether the evictions are still held up or not.
Okay. But yeah, I think that making sure that all the conditions are approved is really what the Board of Health should be doing. So great job there. Dr. Ehrlich, did you have anything?
Nothing beyond what people have already brought up.
I've got, I think, one other thing. With the New York Deli, let's see.
I'll pass that one on to Erin. Steve and I made a phone call with the owner, and then Erin's been down a couple times. So I think it might be in her report too.
Oh, okay. We can postpone that one then.
Yeah, that's definitely a question to talk to Erin. She's been on site more than I have.
Okay. So with that, if there's nothing else on the June 6th, 2020 sanitarians report, I'd like to entertain a motion for that.
So moved.
With corrections, correct?
Moved with the appropriate corrections, yes. You can feel free to change all those typographical errors.
No problem.
No content, though.
No content.
Dr. Ehrlich?
Yes.
Dr. Hashmi?
Yes.
Dr. Walsh, yes. So now we can get on to the health inspector's report, and maybe we'll start off with New York Deli.
Sorry, I had to get off mute here. So New York Deli has had, and I was just looking at it must have been it must have been mostly in May, because I'm not seeing it right now on my report. I can't keep the months on track right now.
I think it's
but we
on
did have,
page
we
one,
had
right after the Dunkin' Donuts and the Extra Mart.
Right, so that was their routine inspection. And I have gone back for their reinspection in the meantime, and they did fix what I had asked. The last time when I went back for their reinspection, the front of the house staff was wearing masks. It was not the same person that we've had issues with in the past. He was not actually there that day. So I can pop in for another check to make sure that they're complying, but we haven't, typically we'll hear from the public if they're not complying, and we haven't heard a complaint about them in a few weeks.
Okay.
Just good news.
And how is the handoff going? I know that people are now allowed to call like the Attorney General's office, and then the Attorney General's office is supposed to be handing stuff off to the local boards of health after they, wrangle up all the, uproar from people. How is that going? Are you actually getting complaints like fed through from the Attorney General?
We've been getting stuff since March, though, Nathan.
Yeah.
It's been happening all along, so it's not anything new. The AG's office, I have several, complaints have been, coming in, so we get them.
See, did anyone else have questions?
Yeah, you have a lot, Erin, about COVID-19 complaints. Are they slowing down?
No, not at all. Just since I've been on this call, I've received 4.
Oh, okay. So, give me perspective.
Actually, I forgot about. I was going to try to get a number, so you could have an idea. Next month, because we keep track of them all. But our complaint response is way up just because of COVID.
We're already over last year's 12-month total for complaint calls for the year, and I think we have close to 100 just COVID calls, if not more. Not all of them get posted in there too.
Right.
I have 3 more from today I have to post that I didn't put in yet.
So Ray, are these Ray or Steve or Erin? Hello?
Yes.
Yeah.
So are these reports of people not wearing masks? Would that be the summary of the complaints?
Soup to nuts.
For the most part, I'd say it's mask complaints, but it's across the board, really.
A lot of craziness.
Yeah. Well, I read the reports, but just thank you. Thank you.
I had a couple of questions. A simple one first. Where is BAPS? It wasn't a restaurant.
It's Indian Meadow, the facility up there.
And their place was had lots of structural problems before. Have they improved that? Is it still in need of more structural repairs, or did they actually fix a lot of it?
I mean,
We were waiting for them to change ownership to see whether they actually improve things.
this was at BAPS.
I thought it was at the Indian Meadows.
So they don't use, they have a very large kitchen. The kitchen doesn't have many structural issues. I mean, they had a couple broken tiles, and some of the coving needed to be replaced.
So Aaron, it was back when Terry was here. We had a lot of issues with the roof leaking. There was doors that weren't working. Those have all been repaired since the new ownership.
Okay. Before my time.
Yeah, before your time.
Yeah. Well, I mean, they also had like things where they'd leave out all their dishes for like, a week, and they'd have mice and rats and stuff in there.
Yeah, the new ownership is a lot better than that.
Good.
Right.
Good.
It's a volunteer organization right now, and they seem to be doing a great job.
Yeah. So if we jump from someone who's doing a good job to the bistro that might not
Yeah.
be doing so well.
Yeah, I want to have that discussion also.
Yeah. So the bistro, I went for their routine inspection, and I had to call Stephen Ray because I just wanted to make sure, I wanted some
Support.
backup support, but I didn't feel comfortable leaving there with the place serving food to the public at that point. So I did close them down on site that day. And I gave them a long list of things they had to fix, and they worked, it seemed, 24 hours a day for the next 2 days, and they were able to reopen 2 days later. I'm actually going back there tomorrow because unfortunately you'll see in our next report, but we just got a complaint. That was one of the calls I just got. So I will be checking up on them again tomorrow to see how they're doing. But they had fixed all the major issues that they had. A lot of them were food temperature concerns.
So this isn't the first time that they've had a poor outcome in recent history. And so I think this is one that might be worth pulling together some history on them to see whether they need to go on probation. It might be that they need a little bit more oversight for a short period of time to see if they can really improve stuff. I don't know what your thoughts are on that.
I totally agree with that. I think that the owners are lovely people, but they don't have much experience right now. So I think having them on probation and having the extra eyes on them a few more times a year would be helpful.
So I just have a question, Aaron. Is this their second inspection since they bought the place?
It's their second inspection, and we have had them in for an admin meeting. I'm just going to go off for 1 sec. We're getting a phone call.
All right, no problem.
Yep.
So just so you know, I believe we had an administrative meeting with them. It was before all the COVID stuff, probably late last year, early this year. Erin may remember it better when she gets back on. But Erin, that's right. We had an administrative meeting with them already, right? Do you remember when that was? Yeah.
I could look it up. It was before COVID,
Yeah.
pre-COVID.
So Steve, just curious, is this the kind of person that we would recommend, like a consultant to or work with, or too early for that?
I think it's
anything we do probation first, which is our usual thing. That might help. That means we're in there 4 times a year. That's usually our first step if you decide to go that route.
Okay.
I think we can suggest that they may want to look into it, but I don't think we order them until they get on probation.
Okay.
Yeah, I think they have to be doing poorly on probation before I'd feel comfortable telling them that they have to get a consultant. This could just be that they just have to, keep a closer eye on how things run, and letting them know that we're watching them and that they're not up to our standards, I think, is the message I'd like to give them.
Right. All right. I'll put together that history for the next meeting.
Yeah, and I mean, if we're thinking about putting them on probation, we do like to have them come in. So I guess we should decide whether we'd like to have them in to talk about it, or whether we're just going to present it to us first and then, possibly delay that a little longer.
So yeah, my bias is that let them get cleaned up from this current bit, have that conversation, and if you guys think that probation is potentially warranted, then have them come in the next meeting. But if for whatever reason you feel like, okay, they're going to do some stuff and we can wait another inspection, then, we can defer. But I'm certainly not averse to having them come in at, whether it be in August or September.
I actually just I'm okay with that. I just think when they come before the board, I think it hopefully it clears the mind, for want of a better word, that that we take this seriously.
Okay. So why don't we have Aaron prepare some the history of the past couple of inspections, kind of a list of what they're not doing right. If in your next time out there, which you said you were going back for, fairly soon, if it looks like things are sliding back from, the correction that they just had, then we should invite them to come before the board at our next meeting. If it looks like they're still in decent shape, then why don't we just have that prepared? We can tell them that we're going to talk about them at the next meeting, but we'll probably be unlikely to, have any direct action at our next meeting if this, when you go back, it looks like it's in good shape.
Sure.
Does that sound okay to the other board
I
members?
agree with that. Do we need to do anything, Steve? Do we need to make that? Can we just say that's a consensus of the board?
Yeah, I think that's what we'll do, and we'll present you the Aaron's list next month.
That sounds good.
Sounds good.
Oh, and Steve, speaking of which, is Masala Cafe, or Aaron, is Masala Cafe reopening? Same owners? Weren't they on probation or something?
Masala Cafe was not on probation. They're
Okay, my
reopening.
bad.
I'm actually going there on Thursday. They're being called the Woodlands Cafe, and I'm doing their pre-opening inspection on Thursday.
Okay.
Let's see. Mawa House had the unauthorized equipment in the facility.
Yes, again.
And this, I think that, what options do we have? I mean, is this something that we don't like the equipment, or is it just that they brought in equipment without telling us? Because obviously there's a difference there.
It's both. They're not allowed to bring in equipment without telling us, but the main concern is it's equipment that should be under a hood, and they're cooking, with grease-laden vapors, and it's not under a hood. So that's why I did contact the fire department.
Yep. Is this something that we think that they should shut down until they remove that? Because I don't trust them to not use it if it's in there.
Well, I mean, I had them remove it to the back room on site. I have not been back for a reinspection yet, but it's kind of every 6 months they have something new in there.
They do, and it's not what I like either. So right now you think that the equipment is in the back room and that they're actually not using it right now? Is that your guess?
I can only assume. I did try to go in for a reinspection actually today, but they were not open at the time I was there. Okay. So I haven't been back in to see, but I would guess that they would not put it in knowing that I'm coming back.
Anything's possible, right? And so in next month's report, just if they are still not doing things right, be stern in the report you write. That way it flags it for our attention.
Right, and actually the fire department may join me the next time I go in, so that'll also give them a scare. Yeah.
Let's see, and then something that occurred to me in the Dunkin' Donuts for East Main Street, where it seems like we're having multiple times where we're going into places to remind them to wear masks and to follow the COVID-19 protocols. The state has a fairly specific procedure that we're supposed to follow in terms of verbally warning first and how many times, and having a written report and all of that before we actually fine a place. They did on today's call with the Mass Department of Public Health, they did actually say that if a town sees something egregious or willful, that we can actually accelerate that procedure. But I didn't know, have we actually given a written warning to anyone yet, or are we still just giving verbal warnings on problems with COVID-19? Go ahead, Ray. You want to say something?
I gave a written warning to TJ Farms for non-mask wearing and not making people wear masks. I've been in 3 times since the written warning, and everybody's been wearing a mask, and the owner has too. That's the only written warning I've done.
We haven't done any other written that I'm aware of.
No, mine are all verbal typically, not that I can think of at least.
Okay. Well, if we keep getting people that you're going back to, like Ray did, I'd like to make sure that we follow it up with a written warning, just to kind of keep the pressure on places to make sure that they are mask wearing.
Right.
Did anybody else have questions about the health inspector's report?
No, I think you covered the big ones.
Then I'll entertain motions.
I make a motion to accept the health inspector's report as presented.
I'll second that.
Dr. Ehrlich,
Yes.
Dr. Hashmi,
Yes.
Dr. Wall, yes. Let's see. Next on the agenda, I think, is director's issues. Am I correct, or do we want to?
Whether it be part of director's issues or not, I wanted to publicly respond to a letter we'd received. So that's a good time now.
Yeah, I think so.
Sure. So I think the simplest thing for people of the public who may, just be watching, is for me to read this into the record. Paul, I believe you included in our packets. So, dear members of the Westborough Board of Health, last night I watched the televised joint meeting of the Board of Selectmen and Board of Health, and I was appalled and dismayed at the fact that you were entertaining the thought of allowing a large crowd event in our town during this pandemic, and that you couldn't come to a clear decision to say no to the man who wants to hold this event. People have been asked to be extra vigilant during this crisis, foregoing their normal activities and doing only the essentials. This is not the time for celebrations in large crowds, even if they're held outdoors. During the pandemic, 1918 pandemic, Philadelphia held a celebration in the streets with a parade for World War I heroes, and it was recklessly disastrous and greatly spread the virus. Westborough has been without a new case of COVID-19 for 2 weeks, as everyone in town has been conservatively mindful of each other. Having this event means inviting people from other towns who may or may not be carrying the virus with them, and exposing our police officers who are assigned to detail of this event, along with volunteers who are managing crowd control, parking, etc., as well as members of his congregation, potentially spreading the virus to the general public in Westborough. The sheer number of people expected is outrageous and selfish and thoughtless. Please rethink what are the priorities of the Board of Health in keeping our town safe and out of danger. I'm afraid, and I'm not going to, it's from a citizen in Westborough. So I wanted to respond to that because some people may wonder, I'm sure if this person had that feeling, then many other people may have wondered why we were doing that. And I think it's important for people to understand that all deliberations by the Board of Health take place in public meetings such as that one and such as this one. That there are no backroom discussions where we work things out and then we present ideas fully formed. That the way we sort out what is acceptable and what isn't is through open dialogue and discussion in these public forums. And it's very easy to say, okay, well, it's crazy to have 2,000 people come in and you should have known that from the get-go. But if this gentleman had wanted to have an event of 25 people or 50, would that have been a problem? Probably not. And so if 50 is okay and 2,000 isn't, then where do we draw the line and how do we draw the line? And having the open dialogue like we did and exploring the ideas, what are the things people would need to put in place to make a larger event be possible, are important so that people don't think decisions are being made arbitrarily. In the end, the doctor who had presented voluntarily withdrew after hearing the concerns that people on the Board of Selectmen had and that the Board of Health had. But I still think it was a productive conversation because there will be things that are in between 50 and 2,000, and we need an open process whereby we have fair ways of deciding what events to allow and not allow. So I wanted to express those thoughts of my own. I'm certainly happy to hear what my other board members think, but I also thought it was important to publicly voice the concerns of a citizen of Westborough about the meeting we had, and to explain why we would have a meeting in the way we did.
Yeah, thank you, Alan. I appreciate you going in there and highlighting that. It also, I have very similar feelings about it as well. I want to go into one extra bit of detail, and that is there's a difference between entertaining a idea so that you can hear the plan, so that then you can figure out whether it's worth going forward with, and approving a plan. Those are very different concepts. And in this particular case, someone had come in, they had something that was not a fully formed plan, and they wanted to, get our opinion on it. And our opinion was that you needed a fully formed plan so that we could actually make a decision on it. And we had basically sent him back to come back with a fully formed plan so that we could decide. And in the process of going back and trying to figure out what is needed to make a fully formed plan, I think that he had decided that it wasn't worth going forward with. And I think that's a very rational and methodical approach to take, and it's one that I would probably continue to do, which is to ask people that are, wanting to have large events that have some risk to the public to spend some time thinking about it and making a plan, and then coming before the Board of Health to discuss that plan. And so I think that Alan is right, that we take our role here at the Board of Health very seriously, and we do listen to all the residents in town. And so if people do send in letters, they do get read. We don't necessarily read all of them every meeting, but we do get quite a few letters, and we do read them. So just so that people are aware. I don't know, Syed, if you have anything you wanted to add, or if we should move on.
No, I just agree with what Dr. Ehrlich and you have already pointed out. I think
Can you please speak up, Syed? You're just a little hard to hear.
Sorry, yeah, no, I'm just saying that I agree with what Dr. Ehrlich said, that, and what you've said, that because we give somebody a voice doesn't mean that we will necessarily do something that would jeopardize our residents' health. But we do want to have an open and transparent process for all residents. Equal justice for everyone.
So I'm going to switch then to Steve, if you've got other directors' issues that you want to bring up.
Sure. So Dr. Ehrlich kind of mentioned these before, but we've had two meetings of our waste committee, solid waste committee, and I'll kind of summarize. We've kind of broken up long-term goals, short-term goals, kind of toss some things around as far as what we think about how to proceed with certain things, and so it's a positive thing. One thing that was discussed was possibly implementing some kind of composting program at the transfer station. I've discussed that with Harvey's, and they're certainly open to it. We're trying to work out logistics about when that might start and other aspects to a program like that. But that's something that we hope to get approved in the near future and have open to the residents. Signage was another thing we're talking about. We're trying still to get better signage down there as far as recycling and that sort of thing. There's other long-term goals which I think we're still trying to hash out. But those are two of the more short-term things that we're trying to do. Dr. Ehrlich, if you think there's anything else to add, please jump in.
I don't have anything to add in the sense of, I think you've outlined what's happened so far, but I do think there's a lot of discussion and trying to figure out what can be done like now to make a difference. And there seemed to be general agreement that having an ability to do composting would be an immediate way people could cut down on volume of stuff going to the incinerator. And that was something that I think everybody, whether you were someone who uses the transfer station or not, felt they could get behind right away. And so because there was a sort of a point of unanimous agreement, and one for which we knew the Harveys were already reasonably favorably disposed to being able to accommodate that, that seemed like low-hanging fruit that could be tackled first. It should be noted that our trash tonnage is down. Looking at a couple year over years, Steve presented that data. Whether that's strictly the elimination of the construction and demolition materials or it's something else, we don't know, but we'll obviously keep continuing to monitor that. But I feel like we have something concrete to get started with, and then issues around should there be the curbside pickup? What's the cost of that going to likely be, and what other types of long-term solutions, as Steve alluded to? I think that's going to be worked out over the next 6 to 8 meetings or so.
Dr. Ehrlich, I've got a question for you, and that's with the composting. I was wondering, is this something that the town might want to subsidize for the first few years, and then kind of like the dump stickers that we've slowly been raising the prices to try to meet costs, that we could do something similar for the composting? Just I would think that if we could, kind of make it cheap and easy for people to use, it would make it very attractive to people, and then get them used to using it.
Steve, I see you want to jump in, but if I could just say a word first. First of all, you subsidize it by just not charging a fee, okay? Yep. And we haven't discussed with Harvey's what their charge to the town would be for setting this up. Obviously, if the composting leads to something that they could sell at a profit, then the cost will be less to the town than if there's different circumstances. So those are details still to be worked out. I know, Steve, you have talked to the Harveys a bit about it, so you want to elaborate?
A little bit. Again, they're looking into, as far as everyone knows, it's very crowded down there. Another container down there. It's not only is it another container, but it's another container with food in it that attracts flies, pests, everything else. So
rats.
And so there is that logistical concern. Plus, I don't know if there will be an added cost to it. We didn't figure this into the contract, so obviously those conversations are still ongoing. And I hope within the next 2-3 weeks to have a better concrete idea of what might go on down there.
Okay. Well, if it turns out that it's not that they're making enough money to subsidize the cost, and so there is going to be some cost to the town, we could go before a town meeting and ask for funds for this project. It's something that the town might actually approve if there is a cost to it. I would rather do that than try to have it be individual people signing up to get like an extra sticker to give them the ability to compost, because I think it would make it less useful and less widely used.
So I certainly agree, and I would treat it much the way we treat recycling. So, for right now, we're not paying for recycling, but that could change.
Okay. Good. All right. Next up, so I had a request from Louise Hetzler, who I don't know if that name rings a bell, but she is the resident that came before you last year wanting to worry about mosquito spraying, that sort of thing, if you remember. So she called me the other day, and let me make sure I get this right. The town of Warwick, Massachusetts, in 2017 banned the use of Roundup or glyphosate, the chemical that is in Roundup. They banned use in town, and she was wondering if we wanted to look into such a ban. I asked her a bunch of questions of like, okay, so it's banned in town, but how are you enforcing that? The chemical is legal to buy right now. Residents can use it. How are you? And she didn't really have any information on that. So I told her I would bring it up to the board to see if it's something we wanted to pursue. And if it was, she has contacts with the people who actually pushed the ban through in Warwick.
I'm emotionally in favor of this.
I'm sorry, Syed, please speak up.
Sorry, I said I'm emotionally in favor of this. This is a dangerous chemical. It has been there's a huge history behind it. So I think from an environmental health standpoint, I'm completely in favor of this. But Steve, as usual with his, got the right questions. How would we enforce it? we're a very small town. There are all those issues. So I do think this is something that we should think about.
So
So-
my thoughts are that we got a couple of issues. One, I'm not sure how much has been linked to environmental problems from Roundup. I know the lawsuits involving Roundup were all related to personal health issues, but not to degradation of the environment. And I always worry if you get rid of one weed killer or herbicide, what's it going to be replaced by, and is that in fact worse? So, so there'd be a lot that we look into this. So I think there's one of two thoughts. Either we believe that there's a public health issue from people using it that would motivate us to act, or if we're concerned about it from an environmental perspective, then I think the Conservation Commission would be the people best equipped to look into that and make determinations. I'm not sure that I necessarily, I'm not that skilled in sorting through all that stuff. So I guess those are my initial thoughts on it.
Yeah, I mean, my initial thoughts on it are that I think they've banned it for public and private lands, and I wonder how they enforce it on the private lands. I mean, if we were even going to go down that route, I think that having it be for public lands is, I think, a lot more in character with the role of the protecting at least the employees of the town. What people do on their own private, property, I like to give people a lot of individual property rights. And the question is the runoff from glyphosate what we're concerned about? Or is it, I mean, I think that, I don't know, my recollection, and I'm not an expert on this, but it was that mostly it's the people that are applying the pesticide that are at risk. And, I have visions of what's in the news, at least, of people that when they're out, they're spraying it, they're walking through clouds of this as they're, spraying it industrially on fields. And they're the ones that have a lot of the, breathing and health issues. In terms of spraying it with like a little squirt bottle on, some weeds that are growing up in cracks in your driveway, I'm not sure that the risk is the same there. But again, I'm not an expert on this, and so if Syed, you know a little bit more about this, I'm certainly willing to hear more of what you have to say.
No, I have to admit my ignorance, but I kind of agree with the thought you're going. I mean, you're saying that we should be focusing on the public employees, right? That would be a way to start. Am I getting that correct, Nathan?
That would be the avenue that, if we were going to go down this route, that would be the avenue that I'd be most likely to follow.
Yeah, I would support you on that. I think that's a good place to start.
So I guess my question in that regard is it the DPW who would be the people using this? Is it the golf course? Who's using the product, if anybody? And can we get information from them about how much is being used and what alternatives would be if they didn't use it?
Sure, I can do that. I talked to the the DPW director briefly about this. He doesn't believe they've used it, for roadside application or anything like that for a couple of years now. But and the golf course I haven't checked with, so I can do more research on whether it's been used on our public lands. Again, I just see this as a nightmare. I mean, so Warwick doesn't have. In the article I read, they don't have anywhere that really sells it in town. They have a lot of retail, that sort of thing. I mean, I could think of at least 4 or 5 places in town that sell it, right? And, in Westborough, and it's a legal chemical. And how, as far as how we go about this, as far as banning the private use of this, I have no idea how we didn't even enforce that.
Yeah, I don't know either. That's why I'm thinking that if it was something we wanted to do, we could certainly have the DPW not use it if we thought there was something that was safer and more effective. I would be concerned, though, that, as Alan had said, that if we were to come out with a ban and they decide that they have to use a second tier agent that might be riskier, that would be a net worse.
Okay.
And for what it's worth, Warwick is a very rural town. it is in no way comparable to Westborough from either a demographic perspective or a business perspective.
And also, Steve's got plenty on his plate. I mean, I think that once the world comes back to a little bit of normal, this is something I think we could pursue. I mean, he's got plenty on his plate right now. So,
So as long as I can get my marching orders right, I'll tell her that, as far as banning it outrightly in Westborough, the board really didn't take any action on that right now. I want to pursue that, but we're going to look into what, as far as public facilities, what's being used in Westborough and see what's being done. Does that sound reasonable?
yes, I think that's
I would even encourage it if we can maybe, I don't know how well you can put stuff on future agendas like a year from now or something like that. But this might be a topic that if COVID has died down and we've got a little more bandwidth that we can think about next year. And if you want to mention to the DPW that we talked about it, just so that way it's on their radar too. And that way it's not a surprise when we, revisit it next year.
Yeah.
Just to follow up on my comment about it being a rural town, I just double checked on Wikipedia. The population at the last census was 780 people in this town.
Wow. Yeah. So I'll tell her that, and I'm sure she'll remind me in a year that, I'm sure if I tell the resident that, that suggestion, I'm sure she'll be calling me in a year to suggest we have it back on the agenda. So, okay.
I think that's reasonable.
Moving on. So there was one, and a resident brought this to my attention. This might be more something for Alan, but when I put out my weekly reports, the state data has a number of confirmed cases on there, but a couple pages now after the front page, there's a page which says probable cases, and she was wondering why we weren't combining those, because in our own Westborough statistics, we kind of combine probable. If people have symptoms and they've been exposed, we always consider those people as being a case. So I'm guessing, I just want your thoughts. I'm guessing going forward, I will probably include those probable cases in the total caseload for Massachusetts. Or do you have any thoughts on that?
I would agree.
Okay. All right. Just wanted to.
One of the things that's changed recently on the state side is that they have, I think, 3 things that they're looking at when it comes to probable cases. And one is symptoms, one is close contact, and one is a positive antibody test. And I think that if they've any 2 out of the 3, they call it a probable case when they are relating it to national statistics. But they're actually counting it in terms of like Maven and, contact tracing as a real case.
Yeah.
And so I think from our point of view, we should also be treating it as something that, is in Maven, that's something that we're actually contact tracing, following up, because it is a real, something of concern that we need to track. As far as what category we lump it into, I would also say that we should treat that as a confirmed COVID case. I don't see the need to separate it out as probable versus COVID, but.
And to tell you the truth, I have been the few antibody tests we've been getting as positive. I have included those in with the probable, because they had it at one time, right? So I have been doing that on our end. Okay. And one last thing. So town elections, and I talked to Nathan about this morning. I was contacted by the town clerk as far as, preparing for, I think it's September 1st and November 3rd, the 2 elections coming up. She has, standards as far as, the suggested guidelines on how to run these elections with social, distancing within the voting halls or whatever. And Nathan has graciously volunteered or was pushed into helping to, as far as spatial distancing, we're gonna try probably to use the gym at the high school and distance the different precincts according to guidelines and things like that. So we'll be working on that hopefully in the next few weeks as far as, to protect residents when voting time comes.
Have we considered having different precincts in different spaces? Why? You go ahead.
Yeah, well, I mean, I guess everything's on the table right now. Her plan that she showed me today, we was going to just use one of the gyms at the high school. I said, well, I think we should probably, if we're going to be at the high school, why not use both? If we use both gyms with, I think there's 5 precincts. I think we can certainly, in every precinct, I think has about 20 booths. So I think we can certainly space people out better that way. I'm told precincts 4 and 5 are bigger than 1, 2, and 3. So we'll have to get numbers on that. This is just rough spitballing when I talked to her today. So again, getting to the high school is easily accessible. It has, we have a good queue area, as we found with the town meeting. We could queue people again down the long hallway and all that stuff. So, I mean, if you have any suggestion, I'd be happy to put it on as far as, different things. But I think it's just logistically tougher to have multiple buildings going at once than just one area. But I mean, it can be done.
Yeah, I mean, the downside of having multiple buildings is the increased cost. You need, more workers, you need more police details, you have to take over more space. Cost shouldn't be our driving factor over health, but, it is something to consider.
Yeah, so I was not suggesting different buildings, but I was suggesting different venues within the same building. So for instance, you could use the cafeteria or the library or the gyms. And again, figuring out what's logistically makes sense. I get all that. And maybe even if you just had the 2 gyms, so 4 and 5 were one and 1, 2, and 3 were the other. But it just makes sense, why not space things out? I understand why they're normally crammed together, but given what we're trying to achieve for this particular election, especially you got a presidential election, you're going to have a big turnout,
Yeah, so with the elections on September 1st, I believe that's like either the day before or right before school starts. And so I don't know if we have to worry about, how do we clean whatever areas where we just had the general public in before, all the students come in the next day. There could be some logistical issues there. And then in November, if we have cases of COVID-19 in the school system, is that I think it would impact, where and when we want to hold elections. And so kind of there's a little bit of interplay between those things that we'll have to worry about as well.
Yeah. Well, we're just starting, so we'll have to spitball all this stuff and figure out what works best.
Yep. It might also be worth mentioning some of these things to the, to Brian Callahan to make sure, obviously I think the gyms are easy because you can set stuff up, tear it down pretty quick. Clean the surface pretty easily. Something like using the library or the cafeteria might be more difficult just in terms of like the effort of like resetting that back up for school the following days. But no, I think that Alan's right, that the more we can spread it out, obviously the safer it becomes.
All right, and that's it for director's issues on my part.
Steve, so Dr. Walsh, I had a couple of things. Can I raise them?
Yeah, go ahead.
All right. So one thing I was actually somewhat impressed by was that this week's, or was it last week's, New England Journal of Medicine, I think for the first time, at least in my memory, had a editorial discussing racism and public health. And I was just completely blown away by how, quote unquote, the New England Journal is now, raising this. So I, on my other, in my other elected office, we released a statement on our response to the recent events. But now that the New England Journal has come out with this, and so I didn't know, I know several other boards of health have talked about this. I don't know if this is something that you want to mull it over. I'm happy to send you the article from the New England Journal in case you want to read it. So I just raised that up for you guys to mull it over. The second is, again, this is partly from my job as a selectman, but I keep getting, and I think Steve has been notified about them, keep getting emails about chicken coops, the noise that they're making, the smell that's coming. So Steve, is that something that's in our purview? It's going to be taken care of by the town. It's going to be taken care of by the animal control officer. Do you?
I actually talked to Christy today about that. It looks like the animal control officer is in the midst of drafting regulations. Okay. So, that should be coming certainly across the selectman's office pretty soon. I not to push stuff off on her, but she already does the barn book, which entails her going around and counting the chickens and things like that every year. She has a relationship with these people already. I just think she's a better.
Perfect. No,
Yep.
Perfect. That just works.
If I can, I'm sorry. Go ahead, Nathan.
I was going to say that the Westborough, in its history, has been fairly agricultural. There's been a lot of farms in town. As Westborough grows and we become more and more like a city, it might evolve us, having rules that change. But in the past, I think that we've always been pretty supportive of people that have, wanted to have animals and chickens and stuff like that. I don't think we have regulations that are onerous or really prevent people from doing that. And I think that what is happening is we're getting people that have moved into town that think that we're already a city and that people can't have chickens in their yard. And so I think that we're getting some of this, issues with growth and density that, the town hasn't really had, 10 years or 20 years ago. And so I think that we're all trying to figure out that path. But I think that right now there's not a lot the Board of Health has as far as, regulations that just outright prevent people from having chickens. I mean, people are allowed to have them.
So I want to just say this is not the first time issues of chickens has come before this board. And the general context in which it comes before the board is when there is a nuisance. So our regulation of chickens comes under our regulation of general nuisances, and that would be related to noise or odor, or perhaps chicken feces. So, I think there are parameters that people who are going to have chickens need to adhere to, but there is no general notion that you cannot have chickens. And many of the places in Westborough have the lots have can easily accommodate chickens without causing a problem. So
then the last thing I just wanted to raise, and Steve, can you just let me know? So currently, are you testing for E. coli in the Lake Chauncey, or?
Yep. We started, I don't know, 3 weeks ago, 4 weeks ago, I forget when it was, but we started off with a banner test. I don't know if you remember that. But we test on Mondays. So unfortunately, the Sunday before our first test, I think we got, it was one of those torrentially downpouring days of rain. Our first test, we hit high. So we closed the beach. It's already closed, but posted the beach. By Thursday, the levels had come down, and since then we've been fine. So we are testing, Syed, and we will post if there's an exceedance.
Okay, so even quote unquote, the beach is closed, but we are still monitoring.
Yeah, that was kind of it's kind of what I thought the selectmen and board wanted.
Right, no.
I told Steve directly that I wanted him to make sure he was testing the beach for E. coli, even if it was closed for recreational swimming. There could be people that go in even though it's closed. And if they do, I wanted from a health perspective something that said whether the beach, has high levels of coliform in there. And so it did, and we closed, we posted it for that period of time. And since then it hasn't. But I think I was talking with Ray earlier today. He was saying that at this point in time, I think there is trash and stuff like that in the beach that's all kind of at the edge of the water. And, because it's not open, people are going there and leaving trash, and it's actually becoming, not so nice. And unfortunately, that's, a horrible situation for us to be in, is to have, some of our really nice beaches get that way.
All right, well, that's it for me. Aaron, I'll come over in about a little while and sign the papers, okay? Thank you for listening.
Okay, and then regarding the New England Journal article, if you send that to Steve and he distributes it, I'm happy to take a look.
Yeah.
Okay.
Apropos what we might do, we don't run a healthcare system. We're not responsible for that type of stuff, and so I have to think long and hard about what kind of statement I would endorse that isn't just trying to look good or
and I don't want us to just do something just to do it. I just thought it was an interesting thing for the New England Journal to publish. I was just like, I'd never I don't think I'd seen it in a long time. I
guess I have a different perspective, which is I'm not surprised in the slightest that the New England Journal published something like that. It's part of what you might call the zeitgeist, and you're seeing that in academic journals of a wide variety at the moment. But in any event, I'm certainly happy to take a look. I don't always read the New England Journal. I didn't see that article. I saw about it, but I didn't see the article itself.
On its way.
Somewhat
Thank you.
related to that, the academic health department, which is a collaborative of a whole bunch of the different schools that have public health departments, have a public health volunteer corps, and they have volunteers that are willing to assist towns in kind of data analysis. And so that would be looking at kind of trends of the data, what might be going on. I think they said that, let me look at my list for a second. They can connect it with the census tracts, mapping and trends, health equity, mortality analysis, and then also any sort of other ad hoc analysis that a Board of Health department might like. And so if we wanted to kind of go anywhere with this, article that's written about kind of, how it's affecting race or other, potential groups, it might be nice to have our data looked at to see if there's actually any trends in common with what's in this article that you read. Because obviously if the article you read has no bearing on Westborough, because Westborough is actually pretty different from whatever group that the article was looking at, then it might not be so useful. But if it turns out that we could learn something about trends here in town, that could be interesting. Steve, were you raising your hand to talk?
No, I was just gonna, if everything's all said, talk about the next meeting, but I didn't want to interrupt. I wasn't sure you were done.
Okay, yeah, so I think that that group, they said that they have extra volunteers. I think they said that they have, I think it was 362 volunteers, and they have 51 different local boards of health that have signed up, and that leaves them with extra volunteers over boards of health. So it was somewhat of an invitation for boards of health that wanted to define a project to be able to reach out to them. I don't have a particular project in mind, but Syed, you seem to always have projects that you'd like to go on. So I kind of wanted to dump that in your lap a little bit, that if you thought there was a project that was interesting or worth doing, that kind of feed this information to you.
Yeah, no, thanks, Nathan. I've put it on my to-do list, so thank you.
And I'll just say that, as you get into this, said anything that involves looking at data and trying to draw conclusions and things like that is something I'm always interested in being involved with. But why don't you take the lead and let us know when it might be appropriate for one or both of Nathan and myself to participate.
Yeah, I think that you've got a board here that loves data, but just doesn't always have the time to actually get into it. So if we can define the project right and someone can, go dig deeper and then present reports, I think Alan and I would be very interested in, hearing from them.
All right. So is it next meeting scheduling?
I don't have anything else. Sounds like we're good.
The third Tuesday in August is the 18th.
Yeah, I think that's a bad week to do.
I'm actually scheduled for my board that day, so
Perfect.
I also.
What about the week before? I just feel like stuff comes up, and at the moment, sooner seems better than later. I mean, we can go with the 20. Well, the following week, the 25th. What's that?
Steve I think that's too late because Steve also needs help with the schools, right, Steve? Am I getting that correct?
Well, we'll see what happens. Yeah, I mean, that obviously is a whole nother thing that we have to deal with. So I don't know, the 11th might be good. I know it's right around the corner, but I don't know.
I favor the 11th. The 25th is also my wedding anniversary. So I get in trouble if I'm not available.
Yes.
So I'm a tentative. I have vacation scheduled, although it's a local vacation. Doing these remotely, I could probably still do it on vacation, but I guess with Alan as chair, it's a little bit easier. So I'll give a tentative to the 11th. I'd prefer the 18th, but it's not a hard no. So Syed, you said the 11th works better for you?
Yeah, the 18th. Paula, correct me if I'm wrong. The 18th, I think, is the selectmen's meeting. I think that's the day. we're having.
No, the
our,
selectmen are the second and fourth Tuesday, so
no,
they
no,
were,
no. We're having only one meeting in August.
oh, I have no idea. I haven't paid
Yeah,
attention.
so I think that's. I think the 18th is the one that we're having it. So let me just shoot Sheila an email. I'll just get back to you. But yeah, the 11th would better for right now.
Why don't we go with the 11th then? And
Okay.
Good. If it turns out I have to take a rare day off, then you guys will have to do it.
you will have deserved it, my friend.
Be my first action as a chair will be to miss a meeting. So good. Okay, sounds good. I think that we need a vote on that, Dr. Ehrlich.
To move it to the sure, yes.
Yeah, and Dr. Hashmi, you're fine with that?
Yes.
And Dr. Walsh, yes. So I think that then we can have a motion to adjourn.
I move we adjourn.
We have a second.
I'll second that. And Aaron, I'm on my way.
So Dr. Ehrlich is a
Yes.
and Dr. Hashmi
Yes.
and Dr. Walsh.
Thank
yes.
you, everyone.
Thank you guys for sticking around. Appreciate it.
Bye-bye.
Thank you.
Thank you, Westborough TV.